20,118 aggregate confirmed cases of coronavirus in Victoria across the pandemic. That is 14 new cases since my update yesterday. 9 of those 14 cases are linked to known outbreaks, and 5 of those 14 are under investigation by our public health team. 1 has been reclassified. There are 482 active cases in Victoria. That's the first time we've been below 500 cases for a considerable period of time, and that is very pleasing. I'm sad to say there are now 781 Victorians who have passed away as a result of this global pandemic, 8 since my last report. 1 male in their 60s, 1 female in their 70s, 3 females and 1 male in their 80s, 1 male and 1 female in their 90s. 7 of those 8 deaths are linked to aged care. Can I, of course, extend my sympathies and condolences and best wishes to those 8 families. There are 58 Victorians in hospital. 8 of those are receiving intensive care and 6 of those 8 are on a ventilator. A total of 2,635,282 test results have been received since the beginning of the year. That is 12,460 test results received since yesterday. That is another strong number, and again I thank those almost 12,500 Victorians who went and got a test the day before. Results are coming back. 90% plus are coming back within 24 hours. So we thank each and every one of those Victorians who came forward and got a test. Any symptoms at all, please go and get tested. Don't put it off for a day. Go and get tested today. It's the most important thing that you can do. Gives us a complete picture, allows us to take the safe and steady steps and brings us steps closer to that COVID normal. That is a message that we have repeated many, many times because it's so important. Any symptoms whatsoever, as soon as you can register, as soon as you feel those symptoms, please go and get tested. You'll get your results the same day, or within a 24-hour period, I should say, and there are more than 200 test sites across the state. It is absolutely critical. These numbers are trending the trend is with us. These numbers are falling, and that is very pleasing. The strategy is working. We've got to keep those test numbers up so that the numbers that we get each day are, as best as possible, a true reflection of how much virus is out there in the Victorian community. There are 4,268 cases with unknown source. That's an increase of 1 since yesterday's report. There are 77 healthcare workers who are active cases. We send them our best wishes and we thank them and all their colleagues for the amazing job they do every part of the state, every hour of the day. It is the most worthy of work. In terms of the metro-regional split, of the 14 cases today, 12 are in Metro Melbourne, 2 are in regional Victoria. That is to say they're recorded as being in regional Victoria based on the address, the postcode on their driver's licence. I am advised, however, that those 2 new cases that are linked via their address to regional Victorian postcodes, both those people acquired the virus in Melbourne and have not returned to regional Victoria. These cases will not affect the regional rolling average or regional cases with an unknown source. I can further confirm that there are 4 new cases in Greater Dandenong and 1 in Casey. I'm afraid I don't have further information as to whether they're linked to that Hallam cluster, but in the usual way that will come forward as part of the Chief Health Officer's media release later on today. In terms of active cases in regional Victoria, there are some 11 active cases in regional local government areas under the 3rd step. The rolling average to the 24th of September for metropolitan Melbourne is 25.1, and the rolling average in regional Victoria to the 24th of September is just 0.8. Again, those numbers are a credit to every single Victorian, no matter where they live, no matter their circumstances. The amazing work that Victorians are doing is what's driving these numbers down, and the strategy is being successful. It is delivering the outcomes that we wanted. In fact, it has us in a position where I think we are ahead of schedule, but again, that'll be the subject of announcements and further commentary and other decisions that will be made between now and Sunday. I can't presuppose where we'll land on Sunday, but we're certainly well and truly within that 30 to 50 band in order for us to take those next steps. In terms of aged care, there are 247 active cases in aged care. I want to point out to you that the total number of deaths associated with aged care facility outbreaks is 619. That's an increase of 8 since yesterday's report, 7 newly reported deaths and 1 death that has been newly linked to aged care. That was not clear, it was not obvious, but that link has now been made and therefore we have adjusted those tallies. Active cases in disability facility settings remain at 4. They are all staff. That, I think, is probably all I need to go through in terms of the numbers of the day. The Deputy Premier and Education Minister has joined me to speak about VCAL and VET students, so those students in the more senior years and some arrangements we've made there. Just